You are welcome to another edition of The Voyage. This is an interesting conversation that we're going to be having today. I have in the house a special guest. He is a doctor. You see, I like talking to professionals, and also because ignorance is terrible. And without having the necessary information, you cannot gain deliverance and victory over, over ignorance. So in our edition of the Immigrant Voyage today, I'll be talking to Dr. Femi I've known him for quite some time now. And so it is interesting that we'll be going to be having this conversation together. But to kick our conversation, before we get into his professional background and training, I would like for us to get to know Dr. Femi. Can you please introduce yourself and tell us as much as you can share?
Sure. Thank you so much. First and foremost, thank you for having me on this platform. I don't take this for granted. My name is Dr. Oluwafemi Olarubofin. I'm actually a doctor in nursing practice with specialization in mental health. I've been in the mental health space for over 10 years. I've worked in different aspects of mental health. I started being a father and also an husband. Like I said, I worked in different aspects of mental health. I currently work for the VA, more in the administrative aspects. And I started my own private practice, which is called Unhealed Behavioral Health. And part of that is basically rooted out of my passion for mental health, to basically, destigmatize the stigma in mental health. And also I consult for Social Security on the matters of mental health.
Wow, that is a lot to take in right there. We'll still talk about the stigma that is associated to mental health. But before we get there, let's talk about you're an immigrant in the U.S., just like myself. Why did you choose to relocate to the U.S.?
Okay, that's an interesting question. Well, I never, intend to be in the U.S.
Really?
Yes. So in 2008, I was actually wrapping up my project, and I got a call from Lagos because I schooled in University of Jos. My parents called me. They were like, "Oh, you need to come to Lagos." I'm like, "For what?" They told me there's something awaiting me in Lagos. I said, "Can you allow me to wrap up, my project?" So long story short, I drove. I had to take the bus to Lagos. So my parents handed me an envelope, and when I opened it, it has the US, like, I want a visa lottery. So I told my friend, I was like, this is scam. I didn't play any visa lottery. So it was then that it dawned on me that one of my aunts actually was the one who played visa lottery for me. Even the picture she used, I didn't know where she got the picture from. So I was never one of those who actually had that urge or the pressure to want to relocate, because I believe anywhere I am, I'm going to be successful. So that was how the journey started. I went for the interview, and here I am today.
Interesting. So yours was not in search of a greener pasture, or the popular Jackpot story that we hear about.
Nope.
Oh, wow, that is interesting. Wow. So what was your first week in the US? What was it like for you? Any major shock when you arrived into the US?
Well, I think one is the fact that there's a structure, a better structure, the road network, and seeing an environment where things work.
I'd say.
So it basically also changed my mindset as well. And also some of the shock was the credit system. Because back where we come from, is either you have the money, you don't have the money. So if you don't have the money, you cannot acquire it. So it was hard for me to, I was like, to wrap my head around it. So, but after a while, it took me actually almost a year and a half before I actually had my first credit card, because they said you can't do anything without a credit card. So those are some of the things that was basically like a shock to me.
Interesting. Now, let's take a little bit, let's talk about, now that you are in the US, so you said you were wrapping up your project in school when you were given the good news about coming into the US. So how did you find yourself in the profession of mental health? Before you even talk about that, was there ever a moment that you regret coming into the US?
Well, I think in the first 2 years, I would say I won't say it's a regret, it was a frustration that I want to go back home. I think there were times I had to call my parents, like, because I want to go back to Nigeria. So because when I was doing my project, my aim was I was going to have a white collar job, and so that was like, so the future looked so bright for me. The kind of the life I wanted to live, the dream.
Yeah.
So this basically kind of like came without me having any kind of knowledge about it. So it kind of like threw me off. So coming to the US, I think the first job I had, I worked in a group home, and it was very hectic because I've never worked in my life before I actually, migrated to the United States. So working with that population was a little bit very hectic because it was something I had to adjust to. And I was like, I did not have my first degree to basically do this. This is not what I had my first degree for. So it was also one of those shocks as well. Yeah. But my parents were always there to back me up, to support me, pray for me, and also friends as well. That just keep your head down, do what you got to do. You got to basically start from the scratch. So I had to muzzle up what we call that inner strength to forge ahead, and like, okay, I have to basically look for a way how to buy. This does not be my destination, my ending point, because I wanted a bigger dream. I wanted a bigger vision for myself. So just to wrap it up, it was from working in that space that I had that calling for mental health, that I had that passion. And when I say passion, because people are like, no, it's, everybody when they come, because most Nigerians, when we come over to the US, everybody wants to go into the healthcare. That wasn't it for me, because I already had my first degree in Nigeria in business management. Okay. So coming to the US, my intent was basically to probably go to a business school, or probably, have my MBA. I already actually had I actually had admission in a school for me to further my education, but there was something, that incident that basically happened while I was working. I was working for a particular patient who was actually an autistic patient. While I was reading the care plan and all that, because where we came from back home, mental health was something we don't talk about. It's something we basically brush. True. So it's not something that we actually have a conversation about. So me now taking care of someone, because for you to better take care of them, you have to basically understand their care plan, and also the composition of their disease process. So something struck me, and I realized that somebody who was actually very dear to me actually had some of the underlying symptoms this particular patient actually had, without the person knowledge about it. Yes, and I did not even know. So it was because I don't know what autism was. I don't know. Autistic was not one of those most known mental health issues. It's usually depression, anxiety, and other psychosis. So I put a call to because I'm basically for EPA, I put a call through to my parents. I started asking a question. How is this person able to meet their developmental milestone? When they were young, did it take them so long for them to walk? They said yes. And after gathering all those information, I realized that truly this person was actually autistic. This is somebody that is very important, that means a lot to me. Wow. I was crying over the phone, and I told him, I was like, I feel this person actually has autism. He actually has autism, because we're always comparing, this person is smarter than, so based on the person's age. So I took it upon myself. So it was a negative experience. I was like, I'm going to turn it into a positive experience. I don't want another. That's very important. That because of that experience, you now make a decision to turn the negative experience into a positive experience. Yes. Please go ahead. So because I realized that it was out of ignorance, that they don't understand, and also lack of awareness about mental health. That was how they fell victim of this disease that they didn't even know what this person had. They just felt this person was not just smart. So what I did was I actually had to make a detour. I told you I already had the green light for me to go and further my education, masters and all that, because my vision has always to be a business person. So I had to make a detour. It was a tough decision, but I was like, I don't want somebody else to fall victim of what has happened to me. So I was like, I'm going to basically go to school, start from the scratch, learn it the right way, And I was basically a man on a mission. I'm like, mental health is going to be my specialization. So I went to school. I went to go get my nursing degree. When I was done with my nursing degree, my first job was in a psych hospital. So I remember when I was doing my last clinical rotation, my preceptor was asking everyone, "Oh, where are you going to work?" Everybody was like, "Oh, med surg, labor and delivery." And he got to my turn. I said, "I'm going into mental health." She looked at me. She was like, "Femi, you're crazy. You're not serious." Because the expectation is out of nursing school. They expect everybody to work in med surg, to have some medical background before you can actually kind of branch out into some other aspect of medicine or healthcare. So, but they didn't understand my story, and I did not share that mission. It was something that was inside of me, because, like I said, this was a man on a mission. So I worked at a hospital in Murfreesboro called Trustpoint Hospital. I worked in the detox, so it's basically people that have addiction problem, people that also has issues with depression, anxiety, PTSD, and all that. And from there, I worked in other aspects as well. I worked in child and adolescent. As a matter of fact, out of my passion, I was one of those who pioneered the child and adolescent department for this particular hospital, Trustpoint Hospital.
Wow, that's amazing.
So I was very, commitment. So my passion, my journey was rooted more in resilience, was rooted more in commitment, like I said, to end the stigma in mental health, and also to create awareness about mental health.
Wow, this is very interesting, because you started from turning a negative experience into a positive experience, and that now sets you to be a man on a mission, a man with a purpose, that you are not just driven with the drive to make money, but you are driven with a passion to make a difference, a positive difference, to educate people and to end the stigmatization around mental health. But I don't want us to assume that people actually knows what mental health is all about. So let's go to the basics. What is mental health? Because you see, coming from my African background, people that have mental health, they will say they are the one that you see on the road with, walking half naked. That is an average idea of what mental health is. So, doctor, educate us.
Okay, thank you. So I'm actually going to make this very brief. So let's explain what mental health is. So mental health is basically what I call it a triage of your psychological well-being, social well-being, and your mental well-being. So it's an absence of mental illness. So so mental health basically plays an impact on how you respond or how you react to stress, on how you're able to fulfill your potentials, on how you're able to make a meaningful how you're able to make a meaningful contribution to the society. So mental health basically, it's a very, very important, because it plays a role also in your physical health as well. So the absence of mental health is what we call, the absence of mental illness is basically mental health.
Wow. So it is possible to see somebody that is well-dressed, somebody that maybe, well dressed, but then they have mental issues that they are dealing with.
Yes. So mental health is a respect of nobody. So it's not a function of your race. It's not a function of how you look. It's not a function of the money you actually have. It affects both the rich and the poor. It affects every race, like I said, the black, the whites. It affects the young and the old. So it's just for us to be very sensitive when you see certain things that are out of norm, when you see things that are basically kind of different from what the society expects. So that should basically raise an alarm that something is wrong. And like I said, the fact that you have, there are people who have white collar jobs that we've heard that they've committed suicide.
Very true.
People who have a very successful career that have committed suicide. So it's very very prevalent. So according to statistics, according to the National Institute for Mental Health, about 60 million Americans ages 18 upward, they are basically susceptible to have any kind of mental illness.
Wow.
Yes. So about 4 to 5 adults are susceptible to have mental health illness.
Because of what?
So there's a lot of things that actually plays a role, socioeconomical factors. The fact that you are not able to kind of meet certain expectation that is put on you. And also some of it has to do with just the gene, because I always tell people the way I see mental health is kind of like it's a reflection of your genetic makeup. So sometimes there might be certain things wrong with certain neurotransmitters in the brain. So, and I'm going into the science, but I would try and basically kind of simplify it. So the brain is basically what regulates what most of the things we do. So the neurotransmitter is kind of like a fuel. It sends basically feedbacks to the brain. So when those neurons are not there's a synaptic dysfunction. That is when we start having what we call depression, anxiety. So the way I always tell people is when there's depletion in some of those neurotransmitters like dopamine, serotonin, glutamate, GABA, then we start having what we call mental dysfunction. So that is when it's very imperative for people to basically seek help. So when you realize that all of a sudden you have lack of interest, all of a sudden you don't have any motivation. You used to be a social butterfly. All of a sudden,
you're withdrawing to yourself.
You're withdrawing, social isolation, so avoidance. All of a sudden you're not showing up to work. All of a sudden you're not meeting certain milestone even at your workplace. So all of a sudden like you snap so easily. All of a sudden like you easily get agitated. So
you are telling me all of these things are an indicator of someone that is susceptible or that's on the verge of having mental health issue?
Yes, it's progressive. So it's kind of like a cancer. So it basically metastasizes.
Really?
Yes. So the way it works is when you have it, it's going to come in a subtle way. But if you are basically very proactive, we can actually curtail the spread of your mental health, because if proactive measures are not taken, it can actually lead to some of this to unnecessary ER visits. So when you having certain symptoms, like I said, whereby it's just like you driving a car, it's going to show your dashboard. You can feel it in the steering. The same thing with your body's going to tell you that something is wrong.
True.
So you don't want to brush off those things. It's always good to basically seek help. There's something they said, there's an adage that a problem shared is a problem solved.
Very true.
Sometimes people suffer in silence, even though they know, okay, something is weird, something is wrong. So it's better for you to basically reach out for help. And people who has actually gone through it, or professionals like myself, or even your primary care provider, can actually guide you or basically point you to where you can actually get help. So yeah, go ahead.
All right. So my question, the next question is this: what are some of the misconceptions about mental health, especially among immigrants, and especially among African immigrants in the US?
So one, I think we ignorance. And some of those ignorant are intentional, and some of those ignorance are some of the things we just chose not to basically want to accept. Some of those things are kind of denial. So like I said, part of it is ignorance, part of it is denial. So we come from a place whereby we don't talk a lot about mental health, and we also see it as demonic. So
whoa,
we see mental health as demonic.
So mental health is not demonic.
It's not demonic. So you want to make sure like you basically go by the science first. So if you know you've done all that, then you can actually seek some other holistic approach. So that is the way people see it. And also because of the stigma, people does not want to come out. Now they are suffering in silence. Now it's actually eating you up. Just like I said, it's like a cancer. Now it's spread all over. Because like I tell people, when you have anxiety leads to severe anxiety whereby you start having panic attack. When you have depression, it leads to a point whereby you start having what we call suicidal ideation, suicidal thoughts, and you can actually lead to a point whereby you basically take your life. So from where we come from, I think part of it is also the societal norm. So like for men, it's kind of like a sign of weakness if you come out and say you have mental issues. So even when people have mental health issues, even when they know it, they don't want to come out to basically admit that they have it.
Well, these are powerful things, and I don't want us to rush it. Now, the fact that people are not willing to even come out to admit, to accept that they they have mental health. I remember a case of a fellow guy that we went to the same high school, and some of the guys that we went to the same high school that are here in the US reached out to the guys in Nigeria. It was in Nigeria, and they said, well, I mean, the guy was brilliant while we were in high school, and everybody was expecting him to perform very well in life. But like you were saying, when it comes to the association meeting, they will not see him. He will be talking out of place. People were beginning to get concerned, and they asked him to see an healthcare professional like you, and he was not willing. And even he did not accept the diagnosis. He said, "Are you telling me that I'm crazy?" What is the difference between being crazy and having mental illness?
So there are different, facets. There are different, types of mental issues. So we have, what we call the thought disorder, the mood disorder. So it's in layers. So it depends on the severity. So in context of somebody who's actually having mood swings, which is mostly what we call like a mood disorder, like bipolar. So like when you talk about somebody being crazy, so that might probably be some positive symptoms of psychosis, whereby they're delusional. So like the way they reason is different from the way other people reason. So they might probably be hearing voices. They might probably be saying they are seeing things when nobody in the room can see the same things. So like just to piggyback to your question, like the colleague you mentioned. So most times they know they have this diagnosis. Like a lot of people, even though when it's been confirmed that they have it, they shove off this diagnosis.
Wow.
So what they do basically is they internalize it. And how they actually, kind of mask some of the symptoms is they go into what we call the use of substance. So they start drinking.
Very true. That happens to this guy. Very true.
So they start drinking. So the drinking basically is just to numb their mental health. So to kind of like numb that they don't have it.
So Dr. Femi, can we say that, well, you correct me if I'm wrong, you are the professional, that it is possible that there might be some people who are using drinking to numb their mental health issues?
Yeah, they're medicating themselves. Yeah.
They are really?
Yeah, they're using it. Yeah, it's kind of like a medication to them.
You are out there and you are using drinking, you think you are enjoying, but you are using it to self-medicate a bigger mental health issue. Wow, that is serious.
Yeah, and the thing about, when I, especially for men, the way they kind of like externalize their mental health is they actually go into, risky behaviors. Look at some of the issues going on around the world. Who are the people who actually causes some of this, homicide or suicide? It's mostly men. So women are able oftentimes to kind of like, express how they feel. But men, we often kind of internalize it. So which is, like I said, they kind of, result into the use of drugs and all those things. And these things actually also now causes some other medical issues, because it can actually have an issue, it can cause some, liver cirrhosis and all those things. So because like I also said, your mental health also plays a role in your physical health. If you don't take care of your mental health, indirectly you're not taking care of your physical health. Because mental health can cause diabetes, can cause a stroke. Really? Yes.
Man, ignorance is terrible. Thank you so much for sharing this information. So how can we destigmatize mental health issue? What can we do to correct some of these misconceptions?
I think one is for us to have an open mind. And I think for one is for us to be non-judgmental. When we see people who have mental health, we need to show them the love, the support they need. We shouldn't feel probably they've actually done something wrong growing up. Because like I said, especially from the African background, they're like, they probably laid a curse on him. That is so we have to show them love. We have to kind of like, and also for the person who has it too, they also have a role to play as well. You need to accept that you have mental health issues. You have an issue and you need to reach out and you need to basically embrace all the help you can get. So, and for those who doesn't have it, I think our role, like I said, is for us to be very intentional about it. Show them love, reach out to them. If there's somebody you're not seeing often, just like you mentioned your friend, somebody that you see more often, maybe in church or any kind of gathering, and all of a sudden you don't see them more often. So those are indicators. Even at your workplace, if you have people working under you or your co-workers, or you are managing people, all of a sudden they are not productive anymore. This is somebody that used to be probably one of your high performing staff. All of a sudden they are not performing to their expectation, to their full potentials. So this can be indicative of some issues going on. And which is why most organizations, they have what we call the EAP, Employee Assistant Program. So when somebody is not, because I told you I work as a manager, when I see some of those things in my staff, some of the things I do is I call them to my office, what is really going on? So you as a leader as well too, you have a role to play. So when you see some of those things, so it's just we being very proactive. And if you're not proactive, the moment they have it, you have to help them to be reactive. And the person who has it has to be reactive. The reactiveness is you basically reaching out, extending your hand for help. So don't suffer in silence. So when you suffer in silence, it's basically affecting not just you, other people around you.
So that is leading me to my next questions that, as a professional, how do you build trust with patients who come from backgrounds that stigmatize mental health?
So that is why you have to be holistic in your approach. So you don't have to one size fits all. And that is why when we're going through this, the education in becoming a provider or a professional, there's what they call cultural sensitivity. You have to understand each person's culture. So it's basically accepting their culture. You don't want to impose your own belief on them. So you have to validate how they feel. If they feel they don't have it, that is fine. But I think you as a provider you want to make sure you're not judgmental in your approach. You want to make sure you make them feel comfortable to be able, to be vulnerable enough to share what they're actually going through. You as a provider as well, you have to have to have emotional intelligence whereby you can actually read into some non-verbal clues. Because not every person that comes through your door for help that is even going to tell you in details what they're going through. So it's kind of like you being able to kind of piece the puzzle together. And also asking important questions. Asking about their background, if they probably went through trauma. Because sometimes mental health too is a function of what people has gone through. So maybe something happened to them growing up, so they never recovered from it, and it's still affecting them. So you want to ask questions, you want to make sure, and you let them know whatever you're saying is confidential, because especially in African population. So the fear is, or you don't want somebody else in your African community
to know about it.
So even if it's not your African community, I think you as a professional, you have to remain professional about whatever is being said to you. It's
confidential.
It's confidential. And that would also help more people to come out to basically, seek help. Because part of it is people feel like, if I tell you I have this, you're going to be looking at me from that perspective. You're going to judge me from that perspective. Because there are people with mental health that they drive on the same road that you drive. But you don't know that they're having. It's just like people might have wounds, but guess what? We cover some of those things up. So you just have to be open-minded and also assurance, and also be very intentional, be empathetic, be compassionate. That also, those are little, little things that basically goes a long way, even before the implementation of your care plan.
I think it's going to go a long way when people begin to see mental health issue just like we see headache or we see any other body ailment. But if we only see it as somebody with mental health as less of a human being, then that is when it becomes a problem for the person and for the community at large.
Yes. So, like you said, and that is one of the the strategy I normally will employ. I always tell people that if somebody can come out and like, I have hypertension. If people can actually come out, you know what, I'm diabetic. Why is it so hard for people to come out that we have anxiety? And I think some of the initiative, we have athletes now, we have celebrities now that are also coming out, part of ways to kind of like mitigate against some of this mental health stigmatization. That the fact that we're successful, we actually have some things that we go through. I remember Michael Phelps, one of the Olympian. So it was. So we're using those platforms to basically encourage people that, so even some of the people you look up to, some of those rich people of the world, celebrities in the world that actually have a lot of accolades, they also struggle with the same thing. So it actually makes it easy for them to be more acceptance of the fact that they have it. And like I said, acceptance comes with you understanding that you have this, embracing, and then taking the next step, seeking the help you need to help you towards towards healing and also towards remission. Because like I always tell people, mental health is a treatable illness.
So it is treatable.
It's treatable. Just like hypertension is treatable. So the fact that you have depression doesn't mean you're going to have it for the rest of your life. So we have people that actually, if they actually have the right, treatment regimen, they can actually get. In my practice, so I'm going to speak for myself. In my practice, I've actually helped people towards remission, partial remission, full remission. Just even in my practice, as in my private practice, Nolo Behavioral Health, there was actually a young man. He works for a Fortune 500 company. Was struggling at work. Was actually having mental issues, panic attacks. So guess what? I had to do what I need to do. I told this person to file for FMLA. So I was like, we're gonna get this under control. So you want to isolate them from whatever could actually trigger or exacerbate those mental health. So I started this person on treatment regimen based on the presentation. After 6 months, they are now in remission.
Wow.
They're now in remission. So it's treatable, and the quicker you are able to reach out, it helps your prognosis.
The quicker you are able to reach out, the better.
Yes.
Wow. Just like in the case of cancer too, the earlier the discovery, better for the treatment and all of that.
Because when it has spread, it's hard for the oncologist to. You can even go to the best oncology; they will tell you it has metastasized all over your body, all over the major organs.
You mentioned something that I didn't know earlier on, that mental health illness can also spread, just like cancer spread and affect other parts of the human body and the whole health as well.
Yes, because the way it starts is one, like somebody who is basically avoiding not going out. It gets to a point they're just in their room. Now they're not taking care of themselves. They're not brushing their teeth. They're not basically taking showers. So now they are basically causing some other medical issues or potential medical issues. So now, because they're eating more, which can actually causes weight gain. Even you sitting in a place, staying indoor, whereby you're not going out, can actually causes you to gain weight because you are not exercising, you are not mobile. And now your brain is not, because the brain is actually now static. The brain is not basically put to use.
Yes.
So now you're having some cognitive issues now. So now it's not just you having mental issues, you're having now some cognitive issues, whereby reality is, you're far away from reality. So, and that is where it gets to the point whereby they might probably have to be hospitalized in a mental health, what we call an inpatient, for them to get stabilized. So it's very, very important for people to seek help. So the progression of the disease, like I said, when you're having a depressive patient, like I said, it's kind of subtle. So it comes with kind of like you having you're not having the desire to want to do anything. You are sleeping a lot. You're basically eating a lot, or you're just having what we call intrusive thoughts. So you're like, oh, I'm better off not being alive. So those are basically intrusive thoughts, and if something is not done, you're going to get to a point whereby you're now working out a plan. So it's going to get to a point whereby you basically work out a plan and basically you take your own life.
Wow.
So so it's actually very, very, it's a serious illness. And just like PTSD as well, so which is more prevalent as well too in men. So you've gone through trauma in life and you want to basically, because you want to kind of you want to
show the ego, the man ego.
Yes. So now you might be able to walk around it, but it's still going to limit you, but you're not living to your full potentials. So your mental health is kind of also wealth.
Wow.
Because if you take care of your mental health, guess what? You're going to have your potentials. So you not being it can actually hinder you from fulfilling some of those things, aspiration you have. Especially for young adults, if you're struggling with depression, anxiety, it could actually limit you from achieving that goal, from achieving that life you actually you're looking forward to. So, like I said, it's very imperative for us to clear this thing out of the way so we can actually live life in fullness.
Wow, that is powerful. That mental wholeness, mental health is wellness. Mental wellness is also equal to wealth as well.
Yes.
Interesting. Now, 2 questions on this area before I move to another segment. Is there any negative impact of social media on people's mental wellness?
Oh, sure. So I think that plays a role as well, because I think, especially with what is going on in social media right now.
Because now people depend on how many likes I get, how many views I get, the comment, how many people share my videos or my comment. People seek for validation from people that they don't even know. Yeah. And does that affect people's mental health?
Yeah, like those things you said. So it basically causes what we call low self-esteem. So because now you don't have confidence in yourself, you're looking for validation from outside. So one, you have to basically understand who you are. So the fact that this is how you're being viewed, because your journey, people might not understand your journey, but you posting things, and sometimes people might even apart from the like, you can post something and people might say something derogatory.
Very true.
And people can even bully you. So because we have a lot of people that they sit behind their phone and they bully you. Some of the things they can't say to your face, they will say it online. And that is why I always tell people to very careful of how you use. Social media is actually a very good thing, and also it could also be very bad depending on how you use it. So we see it a lot in kids. They are bullied on social media. But 10, 20 years ago, whereby there was no social media, we don't see a lot of those things. So which is also very imperative for parents as well to check on the mental well-being of their kids, because they might not share some of those things with you. Wow. So social media plays a role as well. And like I said, I'm not against it, because we're using it. It's a very good platform for you to be able to reach out to a broader audience. Yeah. So, but it all depends on how we use it. But I think the first thing, like you said, is you don't want to seek validation from people. So you don't want. So when I started my practice, people were telling me that you're not the only one doing this, but I didn't allow that to kind of to
discourage or put it down.
Yeah. So, but sometimes that could discourage you, and even people putting bad comments in certain things could also discourage you. So you have to have that mental resilience. But is it everybody that has it? So it's just you, and if you know it's going to become an issue, you have to basically kind of limit the time you spend on social media as well. And also, social media is not a place where you see people they spend 70% of their hours on social media. If you're not a digital content creator, why are you spending that amount of time? So, and that is why kids now, when I'm seeing kids, one of the questions I ask them is, how many screen time are you having? How many hours are you spending? Because those are also things that could actually cause mental illness. Because back in our days, guess what? We play outside.
Yes.
But now you see kids, they're
24/7.
And also parents too, because they don't want to parent their kids. They just buy all this gadgets.
They use the gadgets to babysit.
Yeah, and they too, you see in every family, nobody is basically communicating with each other. Everybody's on their gadgets. Mom is on her own phone. Dad is on her own phone. The kids too, they have their own tablets. So I feel we have to be very, 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 very careful on how we use social media, especially for kids. You have to basically, restrict the hours they spend on this, social media, and also the gadget as well.
All right. Now, knowing that there is earlier on you said that mental illness is not a demonic issue. Now, and a lot of people, because of the understanding of several people about the Christian religion, and also because of the church affiliations or church beliefs, they see things like mental illness as an arrow that is sent from somebody, from an enemy. Please help us to clarify this.
So just to be very careful, I'm not saying there are not some, spirituality is part of mental health. So we're not basically negating that. But the main thing is when you have a mental illness, it's always safe for you to reach out for help. If your provider has done everything and you're resistant to treatment, then you can go on the path of the spirituality whereby you're seeking prayer, which is something we encourage. We encourage spirituality in mental health. So, and also, just to also address, based on my experience, I'm actually going to say something. There are certain technology that are out there as well too, that basically helps with the treatment of mental health. So if you do what we call a gene side, some of those technology are gene side, because people sometimes they're like, I don't want to take medications. I don't want people to use me as a guinea pig. So one thing I always tell my patients is there's some technology out there. There are some testing out there as well. So they are testing for ADHD. They are testing for autism. So you can do some of this testing that are non-invasive, just for you to basically ensure you're following the science. Because if you're in a Western country like we are in, and you have the information there, you can look up some of this information. When you feel you actually check some of those boxes, it's very imperative for you not to be not to be delusional or be in denial. So it's always very imperative for you to go and get care. So I'm not saying as in there might not be some spiritual aspect to it, but I think to be safe, you want to go with the science first. And often is basically some malfunction in your in the neurotransmitters. Maybe there's a depletion in those neurotransmitters. So the way I see the medication, the way I actually talk about medication to my clients is it's kind of like a supplement. So when you giving you those medication, is basically to kind of supplement what your brain could not produce, the fuels that your brain needs. So, and that doesn't mean you're going to be on this medication for the rest of your life. So if you actually very compliant with treatment, you don't have to be on you might not have it for the rest of your life. So like I said, it's treatable. It's something that you can actually walk into remission or get into remission, provided you actually seek help, provided you reach out. So, and also for the the spiritual aspect, one thing I always tell patients is there are different ways in which mental health is treated. So we have the pharmacological aspects, and we also have the psychotherapy. The psychotherapy is basically like a talk. It is a talk therapy. So like somebody who has depression, you can use what we call the CBT, cognitive behavioral therapy. What is that? You're basically changing a negative thought to a bad thought. Somebody who is always thinking about something bad, you're basically walking them through how they can actually see things from a positive side. And I also encourage some of my clients sometimes to reach out to their spiritual leaders to get therapy. That is what we call psychotherapy. You can get psychotherapy from your spiritual leaders, and you can get it from a psychologist. So it's for the provider to see what works for them, so they can still incorporate that spiritual aspect. They can still pray. We're not saying they shouldn't pray. We're not saying they should basically kind of like denounce their religious affiliation. Yeah, you can still pray, but at the same time too, even just the Bible says watch and pray. So you're making sure you're praying, but at the same time, you're also on the other side, you're covering every base. So I think it's always safe for you to cover all bases.
The basic, the science aspect of it is well taken care of first. Yes. Right. Now, another issue along this line is that when you look at, a lot of people also are afraid of the side effects. You talk about the two method of the treatment. Now, I believe the first treatment that may have to do with taking medications and things like that. A lot of people are afraid of the side effects. Do you have anything to say to that?
Yeah, sure. So any medication you take, just for us to be candid, has a side effect. The Tylenol you take, look at the bottles, it has side effects. So any medication you take has a side effect. But does it mean you're going to have that side effect? No. And when those side effects, and some of those side effects, they are subtle. Like if you're taking like an SSRI, some of the side effects are basically drowsiness, dizziness. You find it even in some of this Tylenol you take. Some of this over the counter. So you have to look at the bigger picture. Would I basically now drift away from care because of the side effects? And one of the things I do as a provider is I educate my patient on some of those side effects, what to expect. And not every person is going to have those side effects. So the manufacturer is just giving you kind of like an heads up that this is what could happen, because the way we all metabolize some of those medications is different. The way your body actually reacts to some of those medications is different, which is why I talked about it. What's it called? The technology that are in medicine right now, gene sites. So when you do a gene site, so when the result comes out, you also have access to the reports. You as a patient, you have access to the reports. So it's basically telling you that this is the medication that will work for you based on your genetic makeup.
Wow, interesting.
So on the gene side, there's 3 columns. We have the green column, which is on your far left. The middle one is the yellow, the far right is the red. So it's basically telling you if you have depression, and it's going to list those medications there. So now you are not an advocate now. So if you go see a provider and they are trying to prescribe something on the red side, because on the red side, what is basically stating is your body can actually have an adverse reaction or side effect to those medications. So looking at the green one, so it will tell you what you can use for ADHD, what you can use for psychotic disorder, what you can use for mood, for depression. So now, I think the technology now is basically empowering the patient as well, whereby the provider doesn't have all the control. You have a little bit of, I won't say control, like you have a knowledge about your own care. You are also involved in your own care. So like I said, the side effect, I don't want us to look at the side effect and now cause a bigger problem. Yeah, not everybody's going to have the side effect. And these are actually legitimate concerns. So which is why I always tell people, like I said, you can decide to go the route of the non-pharmacological intervention. So you might decide, okay, let me go, because if you have depression, that doesn't mean you have to use medication. And not every mental issues you have to prescribe medication.
Wow, that's interesting.
So when people walk through the door, it's because I think also we as a provider, so that is where we also have to be very, very conscious of just throwing medication at people. When people come to my session, I always tell them, if you come basically or looking for a provider that is just going to put you on a bunch of medication, I'm not the right person. So there are certain things that it doesn't even require medication. There was a particular incident that happened. It has to do with basically addiction. So the husband was always watching pornography, and the wife found out that the husband was basically these are older people, they're in their 70s.
Wow.
So when he came for my session, you could see the frustration in the woman, that am I not enough for you?
Wow.
So you might want to like, let me put you on naltrexone. Yeah, which is fine. But
what is naltrexone?
Naltrexone basically, it's basically to subdue those
sexual arousal.
Yeah.
Really?
Yeah. So
okay. Well, this is interesting, but go ahead first.
So the patient was like, I want something because my wife is not able to basically
satisfy me.
And these are Christians. So like when the patient actually started this particular medication, the naltrexone, guess what? They have side effect from it, throwing up and all that. When they came back, I think there was an incident whereby the patient actually fell. The wife was not making fun that is the reward you get for your addiction. And I know this is, we're having an open and I'm actually very, open conversation. I'm very serious about this. So when they came back, I took the patient off the medication and I was like, this is not something medication will fix. So I just feel you guys have to talk about this healing. So when you're having the urge, can you talk to your wife about it? And also, wife as well too, when he's having the urge, I'm not saying you have to, you have to look for a way to kind of like, meet in between. So what I did for this particular patient was I told them they need to basically go seek therapy. So not every mental health issues requires medication. Some people, they've actually got into remission even without taking single medication.
Dr. Femi, you are hitting a very big issue. And that question on my mind is, people that are addicted to pornography, is it a mental health issue?
Addiction is a mental health issue. Yeah. So, addiction is a mental health issue. So basically, certain receptors in the brain causes them to always want to commit. It's kind of like a lack of impulse control. So they cannot, because you could choose to watch it and not to watch it. But now because of the addiction, they're addicted to it. They keep going back to it. So it's kind of like a virtuous circle. So if they're like, oh, I'm not going to watch it again, but guess what? They go back and watch it. You watching pornography is an addiction, is a mental health issue.
Wow, I'm hearing that for the first time. That means there are several people out there that need to go and book an appointment with Dr. Femi or whoever their mental health professional person is. That is interesting. So that leads me to another question in regards to that, which is, how does the person that you choose as the person you want to marry affect your mental health?
Oh, sure. Because mental health, sometimes they are... Because if you don't have peace, sometimes like it could also kind of like exacerbate your mental health. Let's say you've actually dealt with trauma. Growing up, you dealt with trauma, and now you're married, and some of the trauma you went through, the person who you're married to is basically now kind of
triggering those things,
exacerbating some of those things. Guess what? It can also cause you to basically go into what we call relapse. So maybe you felt you've healed, but it can be exacerbated. So, which is very important when you're choosing, people, even not just wife, people around you. If you know certain people, they're not going to help your mental health, which is one thing I do. If I know you're not going to help my mental health, I don't put you in.
I stay away from you.
So, and that doesn't mean you're basically kind of like, you're actually segregating them. It's just you protecting yourself. It's just you building a fence around yourself whereby, okay, you know what your weaknesses are. You know what could trigger your, exacerbate your mental health. So the people you have around you, your spouse, and even you as well too, because if you're in a toxic relationship, that can also cause some mental issues, because then it leads to frustration. So now you're not being productive now, because guess what? You guys are always you're going back and forth, and it also have an impact on those kids. And which is why I'm bringing up trauma. Some of us, or some people actually grew up in an environment whereby yelling was basically acceptable. So those things are not, I always tell people like, you don't yell or you don't raise your voice in front of kids. There's a way you can be very therapeutic and still pass the same information. Because
the African mothers, they yell at that, they see it as normal. Even African fathers too.
Yeah, but
yelling.
It creates fear in those people.
That's true.
Fear is also an indicator of mental health, which is anxiety. Fear is part of anxiety. When people actually have anxiety, is part of it is actually fear. So what they're supposed to react to, well, the same thing that other people will react to and just move on, it affects them whereby they cannot basically recover because of the fear. So, and I always tell people that if you understand yourself, if you know, okay, that is going to be a trigger for you, I think it's very important for you to basically talk to the person. And which is why in most organizations, when leadership, there is one of those things they raise in organization, communication, how you communicate to people.
Yeah.
So it's very, very important. So even the way you talk to people, you can actually, exacerbate other people's mental health or mental illness.
Wow. Now let's diverge a little bit and talk about your, you said maybe last year, a couple of years ago, you were able to get your doctorate degree in the nursing practice in mental health. How did you navigate the challenges and the difficulty to have this level of degree? Because you are married, you have kids, you have your job. Tell us so that people can get inspired through what you went through.
Yeah, so I think it speaks to resilience, it speaks to your diligence, and it speaks to your passion. So in life, those things are actually meant to basically help you to the next step. Without a test, there's no promotion.
Very true.
So you're going to run into some detour. The fact that there's a detour doesn't mean you should basically turn back. So was it that during my course of pursuing this, I didn't have there were some detour I had to take. But because I was focused on the goal, I didn't allow those things to kind of derail me from achieving my goal. So we just have to have that mental toughness and also the zeal. If it's rooted in in resilience, if it's rooted in in kind of if it's rooted in resilience, nothing is going to stop you. So I remember when I was doing my it was during COVID, because it was more of both virtual and in person. COVID hit. Guess what? So we couldn't we couldn't go for the in-person, everything was virtual. So even getting a clinical site, I remember then it was tough getting a clinical site. But I had to basically navigate around some of those things. I have, like you said, I have kids, I have family, I have people to take care for at home. But if you know this is what you want to achieve, and if it's a passion for you, nothing is going to stop you. So what I would say that really helped me was resilience and also my mental toughness. I was able to navigate around some of those challenges that present itself, because for you to get to the top, you have to pay a price, and the price comes in different forms. It comes in form of resistance. So you just have to navigate around it, and you don't allow that to basically kind of like to suppress your goal. You look for a way around it.
Interesting. Can money cause mental illness? Lack of money, can it cause mental health issue?
Yes, because you're going to the socioeconomic factors.
Okay.
So part of what the things that causes mental health is socioeconomic factors. So which is why depression is often prevalent in a population of people who are not wealthy enough, who doesn't have education enough, because money actually solves certain problems. And if people doesn't have certain things, frustration builds in. So also even for an adult, adults like maybe in your 60s, so you might have some regrets that, okay, I did not meet this and all that. I didn't meet some of that, the things that I wanted to achieve in life. So the same thing for younger adults. Sometimes when we start facing what we call like real life, it could also kind of, So money actually plays a role, because the fact that you cannot afford certain things, basic things, you cannot afford a shelter, that could actually cause you to be homeless. So a lot of Americans live paycheck to paycheck. So some people are just one paycheck from losing everything they've worked for. So now even we have people that even have a job because they understand they are one paycheck away from losing everything they've worked for. Guess what? It's causing some psychological stress on them. So money can play a role in your mental health. So I'm not saying money is going to solve every problem, but money can causes it, which is the socioeconomic factors, because it's a currency as well. So when you don't have it, you kind of have lack of confidence. Look at how you feel whenever you have something. So when you don't have it, and also because of human nature, you start basically you look at yourself that you're not being successful. And you start looking at people around you or your colleagues, and they are basically thriving in life. Now that is where you start basically you start looking inward into yourself, that you feel you did not, you're a failure. And I hear that sometimes, I feel I'm a burden, I feel I'm a failure, and all those things. So it actually embodies some of those things that could causes or potentiate people having mental issues.
Knowing that you are business inclined and you're an investor as well, because I always love, when people share their personal experience, there is a way that it connects more with people. Can you share any one financial mistake that you made, whether when you were in Nigeria or while you were here in the US, and what did you learn from it?
So we all going to make mistakes in life.
Definitely.
It's the way it's a big way you actually you bounce back that really matters. So because I remember when I was trying to go into real estate, I bought this property, and the property wasn't paying for itself. So now it shows that I have multiple real estate, but guess what? The property wasn't making money for itself. I'm basically the one funding the property. So I'm thank God for my wife. She said something to me. She was like, we need to give up this property. We have to sell the property. And for me as a man, that was a pain I had to go through, because I've always wanted to be in that space. I've always wanted to do real estate. And guess what? It helped me. It's empowered me.
By listening to your wife.
To my wife, yeah.
Wow.
So when we sold that property, we made good money from it. But the fact that, so the money was not because I was trying to build generational wealth. So what I learned from that was, for 2 years, I basically, I was like, I'm not going to involve myself into any kind of real estate. So I was able to learn. So I learned from that mistake. So it was because I didn't do my own due diligence.
Yes.
It was all about, I want to go into real estate. I want to have multi-family property. So when it was now time for me to go back, because now I've learned, I didn't go with emotions. So I didn't put emotions into it. Now I actually surrounded myself with people, and you're one of those people. Actually, I surrounded myself with experts that actually understand how it works, because that is not my bread and butter. Like, we have people like you guys who went to school. You guys actually understand the cons and all those things. The garbage, just like we in medicine.
Yeah.
So I was able to learn from that experience, and now it has actually made me to be a successful, investor. So now, and with humility, I'm into commercial, real estate, and that is because I learned from my mistake. My first mistake, I did not allow that to basically define me. That helps me whenever I'm basically going into any kind of transactional, whether real estate or non-real estate. I'm always very, I try to do my own homework, which is what we call due diligence. Get expert. If you're not an expertise in that area and you want to invest in those areas, it's very important for you to surround yourself with people who actually has knowledge about it. Because marketers, they can persuade you against your will. But when you have the right information, the right knowledge, and having people who can actually, which you can trust, that would also help you. They can navigate you around. So I think, like I said, we're all going to fail at some point, but it's better for you to fail than for you not to even try at all. So the failure, what did you learn from that, from failing? When you fail, most of the successful people we have in the world, they've actually failed in a lot of aspects. This light bulb, how many times? So it's, like I said, I keep using the word resilience. It's the way you bounce back.
Yeah. Failure is not a bad thing.
It's not.
It is an indication that you are making an attempt. It is when you give up, that is when you are a failure. But as long as you are not giving up, you are not a failure.
Yes, you eat it right on the spot. Yeah.
So, looking at success and triumphs in life generally, what is your vision for your practice? I know your practice is located in Knowledgeville here in Nashville. What is your vision for your practice, and what kind of client do you serve?
Thank you. So, well, as you know, I'm the founder and the CEO of Knowledge Behavioral Health. So, Knowledge Behavioral Health was bettered out of a passion to end and to basically, destigmatize, mental health. So the way I've been able to navigate around that, I've been in business I started my private practice in January of this year. So I started seeing clients in middle of March, and we're doing very well. We just had our first, physical location in Franklin. So the goal is for us to have our corporate headquarters in Knowledgeville. So the goal is not just for me to care for people within my geographical area. So we're reaching out to people in other aspects, other counties. I have patients in other counties, even in some people in places I've not been to. So, and some of the things I'm doing is I'm also taking care to my clients, because I think we as mental health, or you as a visionary, because my vision is, I call it a vision of mental health, a gospel of mental health. So I'm doing what we call the mobile health, whereby I'm taking care to people. Sometimes I go to people's house, because if there are certain people who have certain mental illness, they are not going to be compliant with treatments. So you also have to help them. So one of the things I do is I actually incorporate strategies that most providers like myself, or most psychiatrists like myself are not, because like I said, I'm coming from, because of my business background, I'm able to look for measures. I'm able to look for ways to help people to to help people to actually have access to healthcare. So I'm going to be in a place, I've never been there. Martins is actually in Union City. I'll be there in 2 weeks from now. So basically to kind of talk about mental health. So I'm going to clinic, reaching out to clinics, and also collaborating with other facilities. So that is one of the goals. So the long-term goal is for Nolo Behavioral Health to be one of the top mental health clinics in the state of Tennessee. We are licensed to basically provide care in anywhere in Tennessee. And one of the things we're going to use to achieve that is what I call CBOC, community-based care. So whereby in certain areas, because I'm getting patients from, based on the leads we're getting patients from certain areas. And when I ask them, there's no provider in those areas. Because everybody, when you want to set up your business, you want to set it up when people are, people can actually easily access you because you want to make profits. So one of the things I'm doing is I'm taking advantage of technology because offering them the virtual opportunities actually helps. So, and the other things, like I said, the CBOC is we're going to be having small offices in some of those rural areas, so whereby the underserved population too can actually get access to mental health. So it's part of my mission. It's something I'm actually working on. And like I said, we just secured our first location.
Congratulations.
In Franklin. We're working on some more locations as well. So the next location will probably be disclosed on our social media platform. You might probably want to follow us for more updates. And one of the things Nolo does is not just, when you follow us, there are some educational tips that we always post. So it's not just about, so some of the topic we talk is not even about mental, so it's things to help you whereby you don't wind up in front of me. You're not sitting in my office. So it's real life, tips, educational tips that would help your mental health, your mental well-being. So they're very educative, they're very inspiring. So if you follow our social media handles, you would get a lot of information that would help you, that will answer a lot of some of those questions you probably are looking for.
I'll drop his social media handles at the end of this video so that you can follow and you can subscribe, and then you can learn and educate yourself. Like he said, they said prevention is always better, right?
Yes.
So I've seen some of those things that you shared, and they're very, very helpful. As we begin to wrap up our session, a couple of questions on my mind. One is that, is there is mental health prevalent more among a certain group of people, either based on nationality, color, or gender?
Good. So let's start with the gender. So mental health is more prevalent in certain gender than the other. So like for depression, we see depression more often in women than men. So also certain race as well, because certain races are also susceptible to having more comparative rates of mental health. So, and there are different things that actually goes into that. So like certain cultures as well too, they also causes some of those, the prevalence of mental health. So like for the Black population, because of lack of access to healthcare, that could actually kind of causes them to have more, or to have prevalence of mental health illness as compared to the white, or Caucasian population. And also your socio-economic status also plays a role as well. So for somebody who is actually struggling financially, also it can actually limit them, or even if they want to get the help, because there are a lot of providers that will tell you if you don't have commercial insurance, I cannot see you, especially for mental health. I've seen a lot of people that they're not able to get care because a lot of providers, they want commercial, as in they only accept commercial insurance. So your socioeconomic status can play a role, your race can play a role, your gender can play a role. So there's a lot of factors that basically kind of contributing factors that that basically constitute the comparative rate of mental health based on their gender, based on race, and your color. And when you talk about nationality, so they've not been a lot of research to basically say, to talk about, kind of like a nationality. So it's often based on the race and based on the gender. So I think those are the ones that we have a lot of research, evidence-based research, because I don't want to misguide, the audience. So it's often based on your race, also based on the gender as well. That could actually, those are the things that could actually, that we are able to, the indicators we're able to, to use to substantiate, the prevalence of mental health.
On a personal note, how do you personally protect your own mental health while caring for others?
So I think sometimes you just, because a lot of things, you hear a lot, and it's very important for you as well to care for yourself. And that is why for me, the moment I get to my driveway, the moment I shut off my engine, everything ends. Yeah. So you as a provider, you just have to know what strategy works for you. You don't want to take it home, because you can take other people's problem with you home, even while trying to solve their problem. Because there are certain people that have gone through certain traumas. How can somebody of this age have gone through this kind of trauma? And if you have the woman nature, because a lot of providers, they're empathetic. So it's possible for you to basically kind of, in a way, it's just like when somebody smokes, we call it secondhand smoking. It could actually also rub on you, whereby now you are relieving some of the trauma that person has actually gone through. So you just have to sometimes kind of decompress. Sometimes you just have to kind of shut those things down. Like I said, one of the things I do is the moment I basically get to my driveway, my garage, I turn off my ignition, everything ends there. I don't even talk about it at home. I don't talk about whatever goes on. If my wife was there, it was fine. So you have to look for what helps you, because if not, I've seen mental health providers that, because of what they do, because of the population they treat, that's also basically, affected them as well.
Wow.
I had a friend that was actually caring for kids with trauma. So because when some kids tell you what they've been through, there are kids that, they were basically being molested by, they are probably by their father. Even sometimes the parent knew about it. They were basically being set up. When you hear some of those things, it's hard for you as a woman to not want to kind of internalize those things. So, but like I said, the way, me personally, and also the spirituality, I kind of self-meditate. Sometimes I do what we call, guided imagery and deep breathing. So those are the things I use, and music. And also, music, I actually, play piano. So that is the way I also express myself. So that is the way I'm kind of able to release those stress hormones. Because, so you need to look for something that would help you to release those stress hormones. So because they are toxic, the moment you keep it to yourself, it basically messes up your entire system, even how you think. And now you're not going to be productive. You're not going to be a good provider. Because for you to be able to care for others, you need to basically, just like you need to care for yourself as well.
Yeah.
So I always ensure that mentally, I'm stable mentally. I want to make sure I'm actually doing the right thing. And that is one of the reasons why I'm staying fit. Because like I said, because my doctor was telling me about, and I'm going to be vulnerable, because if people can be vulnerable, like I said, if people can come out they have this, I used to have, because my doctor, I have one of the best doctors in the world, Dr. Adewumi, shout out to him. So my A1C is always very, open-minded to me, Femi, your A1C, because when my A1C was 6.1, so I knew I'm basically on the on the verge of having diabetes. Guess what? I understand I need to start losing weight. So I started losing weight for me to also, now it has helped me because it gave me a different level of confidence. The last time I went, my A1C was 5.6. And I'm saying this, I want people to be able to address mental health that way as well.
Yeah.
Whereby, I have anxiety, but guess what? I'm in remission. And that brings hope to somebody, because me saying this now, people will actually, so that is the way I want mental health to be. That is where I want mental health to be viewed. So those are the things that I do that has helped me to be able to better provide care for my patient. That's why we have 4.8 rating just within 3 months of practice. And the goal is for us to have 5 points. So because I listen to my patients, and that's one thing. I don't believe in one size fits all. When they walk through the door, their problem becomes my problem. I want to make sure they're getting a value for what they're paying for. I want to make sure I help them through their journey to a point whereby they don't have to be seeing me every month, whereby they only have to see me once in 3 months, whereby we're able to get them into partial remission and also into full remission. as the case might be.
That is amazing. That is amazing. So, knowing that you are from Nigeria, but before we even talk about that, as we begin to wrap up at this session, what advice will you give to someone that is listening right now or watching this video and they are struggling with their mental health issues? What can they do right now?
Okay, I wanted to, so this is my camera. I wanted to look at me. So I think one, don't allow your mental health to define you. Don't allow your mental health to derail you from achieving what you've come to this life to achieve. Because like I said, if you've listened at the beginning, I said it could actually affect you fulfilling purpose. So for you to fulfill purpose, if you know you're having anything that can actually impact or that can actually derail you, which can be any kind of mental issues, it's always very imperative for you to address those things so that way you can be very productive, so that way you can actually make meaningful contribution to society, and also for you to actually achieve the goals you've actually set out to achieve in life. So those can be life, the dream you want to live. So I feel it's very important for us to basically shift from this narrative of denial. So first you have to acceptance. When you accept the fact that you have it, call it what it is, and then you actually reach out for help. When you're reaching out for help, you embrace all the help you're able to get. So that is the three things I think is actually very important. Number one is basically acceptance. Number two is basically reaching out for help. And number three is basically embracing all the help you can get. And that would help you to be in a better mental state. Like I said, the absence of mental health illness is basically the presence of mental health. So basically, the absence of mental illness is mental health. So you need to protect your mental health, and also your mental health also plays a role in your physical well-being, in your physical health. So they are kind of like intertwined, to go hand in hand. So it's very, very, so you cannot take care of one like, I'm just going to take care of my hypertension. Guess what? You can take care of the hypertension, but you can take care of your mental health. It could derail you from being productive. It could even limit you from living your life to full potential. Because I always tell people, the worst thing that can happen to you is not living your life to your full potentials. Every one of us has God-given talents. You have a purpose in life. You have it. If you're not living up to that full potentials, it's to an extent you're being a failure. So for you to achieve those things, you have to make sure everything that basically stops you, just like you having a car, you want to make sure the tires are fine. Yeah. You can have the best of car, but guess what? If you're not fine-tuning your engine, if you don't have good tires, if they're not aligned, guess what? You're not going to get the best out of that car.
Very true.
So the same thing, so your body is kind of like a car, so you need to take care of it. So that way you can actually, go find life. That way you can actually feel purpose in life.
Thank you so much. Mental health is not a thing. Mental illness is not a thing to be ashamed of. Yes. Mental illness is not a thing to be embarrassed of. Mental illness does not mean you are less of a human being. No. Wow, that is very powerful. On the last note, when you miss Nigeria, what do you miss most about Nigeria, and what is your go-to food when you miss Nigeria?
Yeah, well, thank God for some of the African restaurants we have. So when I miss home, I think it's often more of the setup, not even the food. It's just the setup, like those
chaos.
Yeah, I mean the setup. Because back here, sometimes you don't even know your neighbors.
That's very true.
So that is why sometimes. So one of the things I basically, I'm a man of faith. I listen to gospel music. That actually helps me when I miss home. So because it's a way of healing as well. And the other thing, when it comes to food, I'm not really a foodie like that. But if I'm missing home, if I don't want to stress my wife, because sometimes you don't want to put stress on your partner, because some of those foods it takes time. So I would go to African restaurants and eat something, and that is why whenever I stop by at ATL, because I always ensure that I load my car with all this food stuff. So the good thing is we have all these things around us. So it wasn't like back then, like 20 years ago, that we don't have we have easy access to it. So I just feel one of those things I just miss is
my parents, like my loved ones, are still back home. Sometimes I have to go back, especially for my parents. And me talking about it, because my dad has actually had dementia for 4 years, so I've been going back home more often to see him. And this is because if I'm saying we want to end the stigmatization, I also have to be vulnerable as well, to be able to speak about it, because I also have family members too that also have mental health issues, because dementia is a form of mental health issues. It's just cognitive. So even though people call it an old age disease, but you don't know if you're gonna have it in the long run. So which is sometimes I go home, which is one of the things I miss about home. And thank God for technology, we're able to FaceTime. I'm able to basically call them, I'm able to call them on WhatsApp, video call. So those things actually help me too. But it's nothing as you being there physically. I was just there not too long ago. So once in a while, I've taken it upon myself once in a year when we go back there. Because part of our mission for NOLA as well is as a way of me giving back to my country of birth, I would be going back to Nigeria sometimes next year to talk about mental health. And also to basically do a clinic where we basically run non-invasive tests to educate people about mental health. And also to go back there to educate people about mental health, to basically tackle this mindset that mental health is the money. This mindset that when you have it, you just want to die in silence. So we basically want to share more light to it. And that is something that is heavy in my heart. I feel is a way of me giving back to my society.
Absolutely. I'm tempted to ask this question as much as I want to round up, but what you mentioned triggered the question in my mind. And this is the question of vulnerability, being vulnerable. Is it an African thing that people are not willing to be vulnerable and share their past experience of failure or even of success? That it seems in my little time of doing this podcast, I've realized that while some people are eager to share, some people are very, very hesitant to even share their victory, their success, their triumph, their trials. But unlike the Caucasians of the American community, you see that people are much more willing to share so that people can learn and be blessed from their own experiences. I'm curious whether there is any mental health dimension to this reservation of not wanting to be vulnerable.
So I think it's a function of the mindset. I think it's a function of the mindset and the fact that we refuse to basically grow, psychologically. Because the thing is, the fact that you're sharing this does not define you. You're only basically telling people the journey you're going through.
Yeah.
So it's part of your journey. So every successful people is going through certain things. But I just feel the thing about us is we don't want to portray our weaknesses because we feel that people will look at us from a different view.
Wow,
so
that's powerful. We don't want to portray our weaknesses.
And that is why you see people, what they want to show you on social media is a good thing.
That's true.
So they don't want to speak about, I just shared with you some of the things but people, so they don't know what I've. So it's a way it's actually giving hope to other people.
Yeah.
And I just feel some of the things also is lack of exposure.
Mm.
And even some of us that were in Western countries, we're in Western countries, but we're not exposed. And this is not me taking a jab. I think you have to be exposed. Don't just limit yourself to your environment, your territory. Travel out, embrace other culture, reach out to other people. As in, don't just, because it's basically affect our mindset, whereby we just keep ourselves in a box. And that is why sometimes when we come, our mindset is just, I don't want to go beyond. No, I just want to have a police score on me. So why is it somebody, the same person who actually has a business or who is actually very successful, they don't have two heads. It's just the fact that they understand when they fail, they can pick themselves up. But I think part of it is just the lack of people not wanting to fail. So, and also the mindset that if I basically do this thing and if I fail, which is part of the fear. When you do something, you might fail, but learn from it.
Sure.
So I think part of it is just we want to portray just the positive side and also the fear that if I do it, if it doesn't work out, people are going to make fun of you. Yeah, it's fun for people to make fun of you. But when you're back standing up, the same people who make fun of you, they're basically going to embrace you. So, like you said, and that is why a lot of, the Caucasian population, even Indian populations, they support themselves. And I think the problem also with Nigerian community as well is we don't support each other, we don't embrace each other. We see it as competition, like we're competing with each other.
Oh, wow.
So even in the same church, you see people that they feel like they're there to compete. No, you're there to complement each other. So,
even in the same church, people seem to be competing with each other.
Yeah. So So it's just a function of your mindset. And even in the same, like when you know this, like a particular, maybe like the Igbo association, Yoruba association. So you want, I want to be the person that is the first to drive this car. So why are you putting all this pressure on yourself? It's a matter of time. So I think, like I said, it's a function of a mindset, a lack of exposure, and lack of emotional intelligence. Because the fact that you're educated doesn't mean you don't have emotional intelligence. And also self-awareness. Like, you know what, is a matter of time. So you're not going to achieve everything overnight. Nothing happens by chance. You have to put something in place for you to get there. So it's very imperative for us to allow ourselves to be vulnerable. Just like a child. Basically, so sometimes you have to live a life like a child. So be vulnerable, because when you fall, that is where you're able to get somebody that can pick you up. But the moment you don't fall, and at the same time too, when you're on the floor as well, you can't pick other people up. Because another thing also is, because of our mind of wanting to help, because we come from a background where we want to help everybody, we want to help everybody along. So if you're struggling, you cannot help other people.
True. So
you have to be standing to be able to help others. So I think, like I said, it's just being more open-minded and being willing to take that step, even if we fail, learn from it and raise your head up.
Thank you, Dr. Femi. This has been an educative and an inspiring session. I have enjoyed every bit of this. So until another session of The Voyage, take care of yourself. Mental illness is not a shame. It is something that is just a disease, and you need to consult a professional like Dr. Femi. All right, do take care. Bye.